You have to sit with them and their family and sort of describe what options there are for better or for worse. And you have to help them understand that I know you have a team behind you. The compassion part has to sort of be part of all of this. A woman was dying of leukemia and she wanted to go to her daughter's wedding. That was one of her major wishes. I think they feel more comfortable with their physician if they understand them as a whole.
They love that. And I think when I asked, what do you love? I think the first thing they said was like, she gives hugs.
And I really find that most people will sort of melt and that they will sort of realize that you care and that they become a softer person as a whole also. And then it makes your relationship better and theirs as well. I mean, it makes them heal better.
Hi, welcome to the show, Dr. Schnall. Thank you for joining us today.
Thank you for asking me.
It's a great pleasure to have you, and I'm looking forward to these conversations that we have in the next hour. And to start off, are you able to share with us what you do, and or what did you do, and what's your work like, and specialty and details around your work?
So I retired about 2 years ago, but I was a medical oncologist and hematologist and worked at the Bryn Mawr region. And since retiring, I still do some medical work. I work at a clinic in Westchester for people who are uninsured. So that is part of my medical angle that I still do. And then I do a lot of philanthropic work as well to keep me busy.
What kind of philanthropic work are you doing at this point?
Well, it may not sound a lot. I work at homeless, make sandwiches for the homeless every Sunday, or a box lunch, I should say, or bag lunch for the homeless on Sunday. I work for an organization called the Kevin Kane Foundation, where we, try to raise money for people with cancer. The funds are usually used for patients who are local only. So it's not I guess we could give it nationally, but we assign the funds that we raise mostly to patients in Havertown, and the mainline region. So it's a local organization. So that's revving up because there's a big run, and that happens in April. So we're getting busy for that. So those are my major interventions. And I try and exercise, and I take care of an aging uncle whose
Got
daughter
it.
lives in Florida. So it's my cousin. So I do that.
All right. So lots of responsibilities and lots of interest and lots of work towards others.
Yes.
Yeah, I think the goal of this podcast is to embrace or bring in the stories of compassion. So, compassion specifically in healthcare. And that's what we want to talk about and discuss going forward. So, I know you said you're an oncologist, right?
Yes.
And how long have you been in practice?
Well, now you're really asking me to date myself, but I would say probably at least 30, 35 years. Long time.
Long time. Was there any specific reason what were the things that made you choose the oncology specialty?
It's sort of interesting. I started out just doing hematology, and then to get a job, they asked me to do oncology. So then I did the oncology part, and that became that has more needs, I think, in terms of humanistic discussions. And so I ended up doing more oncology than hematology, just by, in a way, default, but thought it was wonderful. And I think the field of oncology is expanding and growing so quickly that it made it more enticing.
When you're saying it's like growing and expanding, do you see difference in your early career to the career when you're retired?
We have so much more to offer patients, with the precision medicine and sort of detecting certain changes in the cancer cells that not every, let's say, lung cancer has a certain genetic change and certain ones do. So you sort of see that you can offer people many more options, some that you can't. And you sort of look back and you say, oh my goodness, if this guy or this patient was still alive, what I could have offered them now, which I didn't have back then. So I think that makes it even more exciting in a way, sort of one of the more dynamic fields, I think, in medicine and from that viewpoint.
Definitely. I think there's so much that keeps happening with oncology all the time. So coming to the heart of this conversation, compassion, right? When I say compassion or when you hear compassion, how does it resonate with you? What does it feel like to you?
I think, and someone should not go into oncology if they don't have what you're describing is, I think, compassion. Meaning, you have to understand, a patient hearing a diagnosis of cancer, whether it's a curable or not curable type, becomes very scary, and you have to sit with them and their family and sort of describe what options there are for better or for worse. And I don't know, you have to help them understand what they have, and that I know you have a team behind you that can help them get through it all. And spend time with them. I mean, it's not just you have this and I'm going to give you that. You have to sort of let them sort of expose themselves as well, because I think it's very hard to do that to some patients, especially men are much less willing to open their hearts.
We can also say it like compassion is where you can't just give the information out, but you have to sit and take time and spend time in letting them understand.
I mean, you have to give them the time to understand what you're recommending, to let them understand that you're available and you have a team behind you that can also help them, and that you want them to open up, that you understand it's not just them, but it's whoever's with them, their family, their friends, or whatever, to make sure that they have someone that can help them go through this journey. But to me, it was that you were available to them and that you could open your heart. I mean, just have to understand that everybody comes with a story and everybody comes with something behind them. And that's part of them getting better also, is
Got
understanding who comes with them and making the whole picture or the whole package.
got it. Yeah, when you say, I think everybody comes with a story. I mean, what are some of the stories that left some marks?
There's one story this was probably two actually, very early in my career. One is that a woman was dying of leukemia and she wanted to go to her daughter's wedding. That was one of her major wishes. And at the time, you can't leave the hospital if you're an inpatient. And I was at a different facility. I wasn't at Bryn Mawr. And so I had the husband bring in her dress, and the nurses made her up, and we stole a wheelchair, and we got her in the car, and her kids met me at the wedding venue, and she walked down that aisle to her daughter's wedding and did a dance with her daughter, and she snuck her back in. The nurses made up some story about where she was or what was happening, made up vital signs and everything for her to go to this wedding. And to this day, I still keep in touch with her husband, and her daughter became a nurse. So that's one of my most touching stories, because I'll never forget her looking. I mean, I might get tears in my eyes now thinking about what a, not very good thing I did for the hospital, because obviously a liability issue, but she only wanted to go to her daughter's wedding and she got
Right.
there.
That's powerful. It was actually giving me goosebumps.
And but the
And
thing is that the daughter became a nurse, and she like she calls me intermittently, and now her children are all grown, and we still keep in touch, because she said, my wedding picture has my mother in it, and she looked beautiful. I didn't do the makeup, trust me, I don't even know how to do makeup, but the nurses were so wonderful about getting her in her dress and sewing it up because she had lost weight. And I remember, like, oh my God, I stole this wheelchair. What didn't steal it? I sort of
yeah, yeah.
prolonged borrowed it for a while, and to me that it's wonderful. I know her name, but I won't mention it on the show.
No, exactly. Did you drive her to the wedding in
Yes,
your
I
car?
did. I'm the one. They put her in my car, and I drove her to that wedding. And then her son met me at the other end to help me get her out of the car into the wheelchair, but she literally walked down the aisle with her daughter and her husband on each side, and she got there. So
That's awesome. How beautiful. I mean, just out of curiosity, how long was she with us after that?
probably about a month or two, not much longer after that. In a way, I think she sort of gave into it, that she had something to look forward to. She got to that part of her life that she really wanted, and knowing there wasn't that much more, I think she was ready to go at that point when that happened. She tried. I don't think that she gave up, but I think her soul gave up. But I guess that's life. My other wonderful story is that was my very first year as
Mm.
having finished my training, and an 18-year-old girl came into the ER. She already had two children, and the other attending saw her and said, "Oh, she doesn't deserve all of this. She's not an educated person. She has a kid already." And I sort of took her on, and she had leukemia, and we got her in remission, but her match was her brother, who was in prison. And we got her brother flown to Philadelphia and got his marrow. And this was literally, I don't know, this must have been 35 years ago, and I still see this. She came out to Bryn Mawr to visit with me after not visit, to follow with me, and I talk to her at least once a month. And she's alive and well and has grandchildren, and to me, that is and once, my daughter had a birthday party when she was little, and she was a hairdresser, so she came and put everybody's hair in braids. "Should I have to pay you back?" And she did that, and that was sorta and I just so the people like that, I think that when you talk about compassion, it goes beyond just taking care of their cancer. It's like worrying about them, loving to hear about what their family members are doing as life goes on, even if they're not with you. It became part of you. I mean, and to me, that was one of the most wonderful things about being an oncologist. People always ask me why go into cancer. It's so morbid. It's so depressing. But you have to help people live, and you have to help people die. And keeping these lifelong, whether the patient's there and you keep the family or the person. I miss a lot of the patient interactions now,
That
but
is,
I keep in
yeah.
touch. But I keep in touch.
That's so beautiful. It seems like you are in touch with many of your patients.
I meet some for lunch still. Oh yeah, Tabitha was her name, was the young girl, and she now does hula hoop parties if you need a hula hoop party. But she's wonderful, and she just texts me all the time. Christmas, we get together. Everybody should have that patient like that.
Got it. Yeah, I think probably multiple patients like that will
Yeah.
be awesome. So, but you were talking about this humanistic care and the care, and we have to think beyond. I mean, we have to see beyond and also look at the person as a whole and know what they're doing, what they love, and their families, right?
Yes.
So, I mean, that is truly the care. When we say health care, caring as a person, as a whole. But I think these days we are so much into the mechanistic aspects, and I feel that there is some drop in the care, and probably we are treating the diagnosis.
Well, I agree with you 100%. I sort of think of my like, who's gonna take care of me? Like, I'd want them to understand, but it's funny when I talk to patients that I have obviously not working, I keep in touch with, and my dog is my best friend. And to me, I have to say that I grew up without computers initially, so people just are typing on their computer and not making that eye contact with the patient, and that sort of gives you a feeling of what they're feeling and what they're thinking as well. So if you keep your head buried in the computer, I think you're right, the humanistic part leaves and becomes very mechanistic, and for me, that's not why you go into medicine. I mean, if you wanna do that, you can become a pathologist and just look at slides all day. But if you want to be in patient care, you have to take care of all parts of the patient. And at least from my personal viewpoint, I think patients find it more endearing that you care about more than just the fact that they went into remission or that the treatment didn't work or that you have something else to offer them or not. I think they feel more comfortable with their physician if they understand them as a whole.
When they feel that trust or when they feel that compassion come out, right? When they feel that endearingness from their physician, I believe it works on the diagnosis and the condition as well, right? What do you think about? What are your thoughts or perspectives on that in terms of seeing the person as a whole helps cure them or helps them make feel better or make them better
Well, I
itself?
think they sort of, when they're having difficulties with their therapy or things aren't going well, they sort of have faith in their physician that you're still with them, that you just, because treatment A didn't work, you have treatment B, but there's some empathy going in between that why you pick B and which one is better for them. And when their side effects are bad, that you are there with them to sort of walk through that yes, they will hopefully get through that. You also have to be honest that you may not get through that, but I think that the fact that you are with them and staying with them, following their symptoms and offering them hope or salvation, I don't know, but something. So I think for me, at least delving into them helps me as well as a physician, that I can understand them as well, not just their disease. It's not just a cold, type in the results and then move on to the next patient. And, this day and age, there's a lot of physician extenders, as you deal with also, nurse practitioners and physician assistants. And they are very helpful, and patients rely on them. But if it were my patient, not that I don't want my nurse practitioner or PA with me, but it's me who makes the final decision, and I feel like I need to be there for them and make most of those phone calls.
So you were talking about like sometimes like there's plan A and it works, and then if it doesn't, then we go to plan B, and if it doesn't, then we're there with them. But were there situations in your life? I'm sure again, probably numerous, but that comes to your mind when I say was something very felt very challenging to deliver the information to someone, and how did you handle that?
If you deal with other physicians, that's sometimes more difficult because they have an understanding, but not an oncology understanding. So trying to explain it to them, sometimes that becomes somewhat of a challenge. Or you have a patient who is intellectually challenged themselves and trying to explain what your next step is. And also saying, the next step may be not it may have more side effects and the chances of it working are less. And that becomes a challenge to try and explain to them that even though you A, work for a while, B, may or may not work, and we don't have great options. And you also have to be a big enough person to say, "I think you need to go somewhere else." Not that I'm not a good physician, but a place where they can get a treatment that we don't have at our access at the facility where you work. So I think you have to be a big person to do that and explain that to them and why you can't do it here or there. So, yeah, I think it's sometimes challenging for patients. Sometimes the families are a pain in the neck sometimes in terms of their input and their intrusion into it, whether the patient wants them or not. And I guess more challenging is when the patients don't want their family members as involved, but they still do it. So I think that's a challenge as well.
So, how were you able to? I think that is something the world of physicians or the healthcare providers face, right? The challenging situations that we face in our day to day in terms of requests or like not understanding the consequences and trying to keep our loved ones alive for a longer time.
Yeah.
So, how? I mean, sometimes we feel that probably not be ethically correct, but um, how how did you navigate those challenges?
In terms of dealing with family members that were
Weren't entirely, yeah.
I mean, sometimes you just talk to family members aside from the patient, which I don't particularly like to do because I think the patient is the primary person that needs to be involved. But sometimes I ask the family members if they're obtrusive and I feel that the patient is uncomfortable with them there, but doesn't know how to ask them to leave, that I ask them to leave, that I need to talk to the patient by themselves. And then they may get offended by it, but I think the patient is the primary person that has to sort of, the other one that are going through all this and mentally dealing with it. So sometimes you have to ask the family member to leave or you talk with them separate from the patient to sort of have them understand what I guess what I think the patient is going through and what I think the patient needs.
Did you have challenges emotionally that you had trouble delivering the
No,
information?
it's true. I mean, there are, I mean, well, you're a physician also, but, there's a patient you think, they could be my good friend. And then, I mean, like in life, some people are your good friends and some people aren't your good friends. And there's certain patients that you just there's some sort of affinity, there's some sort of attraction to them. Maybe it's that you have the same hobbies or your kids are at the same school or do the same activities and you feel more attached to them. You feel a different connection to them that you don't necessarily feel with other patients. And sometimes you feel badly about that you don't connect as well with one patient than you do with another patient. But I think that sort of adds to the challenge of taking care of a patient that you have to sort of maintain a little bit of that separation because if you get too close, then it becomes more difficult for both the patient and the physician to continue the care.
So, if we think about compassion again, like when we start using that terminology and everything that you're describing, right? It's like caring for them emotionally, being there completely, understanding what they are, and connecting with them. All this falls under compassion. So, I think, have you seen yourself from early on in your career to later on? Has that changed over the years? And have you learned from your oncological patients that you started being a different person, or were you just naturally a empathetic and compassionate person right from
Well,
the
I
beginning?
think, going into oncology, you would hopefully have some compassion at baseline. But I do think it changed over time. I really do. I think learned to understand more what patients need, giving them a hug. I mean, people hate, maybe that's not so good anymore with all sorts of COVID and other infections, but I really feel that, when you give somebody a hug, They just sort of really feel that you're with them. So I think you sort of learn some of those little nuances of giving them a hug, calling them on their birthday. When I had a smaller patient population, I'm sending out birthday cards, but you sort of can't do that anymore. Well, now you can send an email, but it's not the same. But you call them on their birthday, go, "Oh my God, it's your birthday." So little things that I learned to do over time. So you're right, you do hopefully became more compassionate, more understanding, and more loving to your patients. I mean, there's certain, I mean, that's what I really miss. I think that sort of touchingness and sort of interjecting into their lives.
So I think now that you brought up the loving part of it, right? I want to take a notch up. You already said loving. I love that because I'm also a lot about love and compassion.
Yeah,
So I think, do you think there is a difference between compassion and feeling uh, that unconditional love? I don't know. Probably that's a little too much to
for a
intricate what
patient.
it is. Yeah, but basically, I think love is that feeling of brotherlyhood, the connectedness,
Yeah.
right? I mean, and I feel personally we are all interconnected. And so, but what are your thoughts on love in healthcare? Love,
Well,
and
I think you're right. There are levels of compassion. I mean, you can say, "Oh, I feel sorry that it's not working," and you whatever. But I think if the patient feels that in return, not it doesn't feel cold. It comes off as a warm, and you say loving, because I think like even a little kid, you can sense if someone truly cares. It's not just giving out a lollipop or something. It sort of means, looking them in the face, looking them in the eyes, face to face, and saying, "Okay, this stinks and it's not working well, but we haven't given up. And that, I'm in your court and I'm going to try and find something." And then, but I think that the flip side is that you have to say, "I don't have anything else." And I am, and that's one of the worst things I can tell someone. But unfortunately, you do it more than you'd like to admit to. But that they know that you tried and that they know you're still on their side and that you will help them through whatever transition happens next. So I think there is a different level of compassion, as you put it, that there is understanding and saying, "Oh, I'm so sorry," as to the other end, is that giving them the hug and the love that a lot of people want. Some people don't want it. It's sort of interesting. Some people don't seem to find that that makes them any better or makes the situation better. And you can feel that in a patient. You can see where they're a colder person at their baseline and they don't need or want your compassion to that level.
I agree. I think yeah, I mean, I'm a person who offers hugs and gives hugs as well, right? And I actually heard from my patients when I was admitting about your hugs and you're a hugger, and they love that. They love that. And I think when I asked, "What do you love?" I think the first thing they said was like, "She gives hugs and she's so sweet," right? So those are the things which are actually coming out rather than the clinical care or the diagnostic
Right,
ability.
but, you do care. I mean, if you wouldn't do it if you didn't care, they can feel your sensitivity, they can feel the intensity that you're hopefully giving them, that it isn't just you're just not just medicine, that there's a piece of it that's separate that you can't measure.
At this time, can I take an opportunity to actually ask? So I think we were talking about some people are cold, probably just give the diagnosis and move on. Some patients may not want to, I mean, are cold, can't receive that as well. For people who are in that zone, right? But I'm sure they would want to, I mean, some of them would want to change and become more warmer, and some may not want to change, and that's okay. So for people who want to change and see if they can become more warmer and be that person who can care as a whole and send out those vibrations where our patients and friends and colleagues can sense. Do you have any tips or tricks or ideas or what should be they doing differently?
Mean, what
Or
the physician how a physician I mean, I think it's always good to ask them, like, what are their kids doing? Like, "What are you taking a vacation? Did you enjoy your trip to Morocco?" Did enjoy something so that, you take a step back from the medicine and from the good or the bad of their medical care, and just sort of ask them, your life outside of here, and how is that going? I'm not sure it's a distraction, but in a way it is, but it makes them like a whole person. So I think that you sort of separate out their disease sometimes from their family or their personal life. And I think that helps. And I think physicians have to do that, get their head out of the computer. But I think sometimes it's hard too, the way medicine is going in terms of you have to see so many people in so much period of time if you work for a business. And that makes it more difficult for physicians to have that luxury of spending 25 minutes with the patient instead of your designated 15 minutes, and realizing that your day may not end at 5 o'clock, that it may end at 8 o'clock.
Like yours, like all the time,
Like
right?
yours too. I mean, you just stay till you feel that you've done what you need to do. But so I think that part of it is, I think it's a new generation. I hate to say that, but I think that, they have different restraints for who they work for that may make them that way. I don't think I could ever do that, because for me, understanding my patient is so important to, wishing them a Merry Christmas, or whatever.
And I feel that, I mean, there are all kinds of physicians still in terms of who, I mean, even the younger generation. Recently, I was having a conversation with one of my colleagues, I mean, my boss, who's in a boss position, and we were talking about this, how this younger generation are actually, I mean, have not been able to care as a whole, or rather not able to see as a whole. But my point was like, weren't we the ones who introduced these checklists and these processes, and we've put them there, right? I mean, that's what they're walking into.
Yeah.
And we're missing out on that learning of compassionate side, or caring as a person rather than a patient, right? And we
Yes.
are missing on that. And I think, and the I mean, the big thing we want to do is like bring in these stories out through this podcast series, and see that there is beauty in that, and how we can probably enjoy the joy of
Yeah.
medicine and healthcare. I know we all probably, most of us are probably in this field because we are those people who want to care for.
Yes, I agree with you.
Maybe not everybody agrees with that. I'm sure some of them are here for financial stability, could be authority, we don't know, but I think we're all probably people's people.
Well, I mean, I think we all want to make a living, so there's no doubt about that. We're not, but yeah, I think that the compassion part has to sort of be part of all of this. And, I have medical students actually come to the clinic, and I sort of, I go in the room and I come out and I go, did you see anything that I did differently? I said to this one student, anything that I've done differently? And he said, well, you gave them a hug goodbye. I said, this is the first time you met them. I said, yeah, that's right. But they know that, I'm there and that I'll come back again. And, my daughter's a physician. I told her I'd break her neck if she didn't have compassion in her care. But I think that, and also it's interesting, like over 50% or more of medical school classes, at least in the United States, are women now. When I was in medical school, it was 10 to 15%. Not that I want to be sexist, but women tend to have a little bit more compassion, maybe too much emotion, but that's just nature of what we are. And I think that hopefully with more females, that will add to the role of compassion and caring and patient care.
Yeah, and interestingly, I think that makes me think of somebody who I just met yesterday. It was my patient. He's a physician per se, and we were talking about, in general, did the initial talk and discussion, and this thing about, I don't know how it started, but it started off like started talking about compassion in healthcare, and he said he gives hugs to his patients, which I felt so happy that his first physician who's male that actually. Yeah, I mean, that was great to hear that. I'm hoping more and more, I'll find more and more people who are in the genre, and who are there
But
to
it's so
give.
gratifying. I mean, it really is, because I mean, not only do you make them feel better, but if it's genuine from you, they can detect that. And it truly is. I mean, if you didn't want to be with people, then medicine isn't necessarily the field for you. And that, I always stress to the students or the residents, because I don't do this if you just want to make money. And fortunately, medicine isn't the big money maker now. I guess going into business and wealth management is where all the money is. But you have to be satisfied what you do every day. So if you're going to sit at a computer and sort of look at screens, where does that get you? But for me, the interaction with the patients and with my fellow physicians,
Mhm.
it makes a difference in terms of your everyday, like you and I were in this together, and like, you do your bit, I can't do blood pressure and cardiac management. And we both care for the patient. They have to know that we both work together to get them healthier.
Nice. So I hear that basically you teach a lot of compassion based skills to your med students or whoever is
Try
routine.
to, yeah.
I don't know if there is a lot of teaching and training in med schools otherwise, right?
I don't think so. I mean, I think it's like on the job training, so to speak. I mean, I think they have to see you do it or and why you do it that makes them see, and then the patient reacts in that positive way that makes them hopefully want to integrate that into their daily routine.
Hmm.
And
Hmm.
that I think is, all those little simple things. I mean, now so many classes are done online. You're not even in the auditorium or a classroom with the physician anymore. You're just looking at a screen
Yeah.
and missing sort of that, like we are, but I mean, but missing that sort of interaction and the ability to raise your hand or look at the person next to you and see what they're sleeping or are they paying attention. So I think, technology is great. As you and I figured out, it wasn't so good in the beginning, but I mean, I think that the day-to-day in-person training and teaching really has to be maintained. Otherwise, it does become a mechanistic thing. And I worry about AI. I'm not going to throw that out the window, but are we
And
all going to become all you have to push a button and say, I have this symptom and that's what it is. And then you don't have to see anybody.
I don't know. I think in a way, I mean, probably that's there, but in a way, I feel that the purpose and role of AI is different. I think we've been doing a lot of routine things, mundane things, and we've been away from creativity. And I feel like it's important to leverage these tools of AI and probably becoming more creative. And I feel primarily our purpose is to love and be creative as
Well,
human
it's
beings.
true though, because you go to AI and they say you have A and B symptoms that you have C, but as we all know, nothing is that easy or direct, and so you have to sort of tease that out. Dr.
That's
Google is to me our worst enemy when a patient comes in and says, "Well, the AI was Dr. Google tells me this is what I have," and I go, "Well, maybe not," and you have to sort of
yes.
figure
There is
that out. So that's a good point that you bring up.
that is, yeah, we can leverage, but again, I think also become creative in different ways and probably evolve into higher human beings. We don't know. We'll see. I don't
Yeah.
know. All right. Um, so that being said, in terms of the students or the fellows that you had or colleagues, can you think of somebody and who had been extremely compassionate as you are, and have you learned things from them? Any stories from your colleagues or who have been?
I think I had one attending when I was a fellow, and he was, when I first met him, he was like so professorial, had the bow tie, and that whole, always wore a suit, and I don't think he ever wore a white coat. He was just so prim and proper, and he had a sort of a semi-fake English accent because he was born and raised in the United States. He had nothing to do with that. And when I first met him on that, I said, "Oh my goodness, this is going to be a tough road for me." And he was the most wonderful, warm, and loving physician that I can ever remember, and that's important. So I agree with you that he was unbelievable.
God,
Tom Duffy was his name.
awesome. So, what were if we want to tease out the behaviors so that we can start incorporating those behaviors into us to become more of that kind of a person, what are the behaviors that you recognize and can tease out and share with us that made him that warm and loving person?
That they were all the same, whether you were a rocket scientist, whether you were the janitor, whether you were someone who couldn't even speak English. So we were all equal. I mean, all those patients were equal to him and they all got the exact same care. And I think that was important because sometimes, like at a job when I described the young girl with leukemia who was 18, the physician that initially got assigned to her said, well, she's not smart enough to get a bone marrow transplant. And she's already 18 with 2 kids. And I said, that was sort of passing your judgment. You may not want your daughter to be 18 with 2 children, but that doesn't mean it's right or wrong. It's just how you look at it. So I think looking at each person as they're all the same, whatever their disease is, everybody with lung cancer has got a bad problem. And it doesn't matter whether you went to college or you didn't go to college, whether you're married or not married. It's just that we're all the same and to treat everybody the same with that compassion because they all deserve it.
Yeah, that's powerful. And that's so true. And in situations where we have a lot of addiction issues in the hospital, and there's chronic pain issues, chronic GI issues, right? Those are some of the challenges we constantly face in the hospital systems.
But when patients have like these chronic symptoms, I always say there's got to be something behind it, because if you don't find a real physiologic reason and you've given them medications and other agents or lifestyle changes, but then there's something behind that. Is it trying to get attention from a family member or spouse that's not giving them attention that they think they should get? Or is there a child or another loved one that's going through so much stress that it stresses you, but this is how you can focus on yourself by saying, well, I have pain too. So it's sometimes a challenge to find out why they have a symptom that's not always well defined, or you can sort of delve out why they have it, or is it just psychosomatic, but there's a reason for that, and helping them sort of sort through that.
Yeah, right. Yet. And I think it's probably really important to build that trust with your doctor, with a physician, and that makes a huge difference.
Well, yeah, you have to let them know that you're there for you are there for them and you and they're here for you. I mean, I learn from the patient also. So, you learn from them as well, and you have to and if you and some patients appreciate that you can tell them that I may be your physician, but you're my teacher in a way. I learn from the patient. But you're right. I mean, and I've seen you do it too. It's just that you have to sort of sometimes put yourself in their shoes. Say, what would I do if this was happening to me? And hopefully, I'd behave differently. And if you need to, or I would be. So I agree with you. I think that's important.
Yeah. I mean, I've seen myself changing in that situation. Actually, I think probably but especially the pain and the what do you say, this substance, illicit drug use or anything. It's not that they would want to, and a lot of them want to be out of that most of the times. And but it's just that I think it's the opportunities or the support that they have and the trust they can put on themselves and the trust we can put on our patients who are going through, saying that you could do this probably helps quite a bit.
Yeah, I mean, they do need that. So, but you're right. I mean, they get somehow boxed into a situation, whatever the issue is. And I feel it's like very hard to get out of there, whatever that box was, however you got into that situation. And so they have to know that there's a system out there that will help them, whether it's just one physician like yourself, or is it going to a center that they need to get
Mhm.
totally cared for, but then putting them back when they're through that, making sure they don't get back into that rut again, because sometimes when you come through that, do they have something else to grasp onto to keep moving them forward as opposed to just, okay, so you stopped using the illicit drug or whatever, but now what are you going to do? Do you have a job? Do you have a place to live? Do you have a meaning for your life?
And that's probably the biggest thing, right? Meaning for your life and the purpose. When do we have purpose? Is there a purpose that
Yeah. I mean, even if it's just getting a job, a menial job, but you have a reason to get up every day, to get dressed, take your shower, and go to work, as opposed to getting up and having nowhere to go. So I think that sort of makes a difference that you're getting your life on track as we see what a life would be.
I know, in terms of time, I think that is the biggest. I think when we talk to our colleagues, I think the biggest challenge is like time.
Yes.
I don't have time for this. I don't have time to stop by. And I think there are so many demands that goes on. Personally, I think sometimes, despite the fact that there is not much time, sometimes just the way at how we look at things, like the intention to help, intention to care, and the attitude to care, or even that change will make a huge difference from being that cold to a warmer and loving and person who hugs, just the intention and the attitude. So, I mean, what are your thoughts on that? Because I mean, we know we blame a lot on the time. I do agree that we only have so much, and the number of patients that we are having to see is going up. But
Where, medicine becomes a business rather than what I would think it is. Like, I mean, it is a job. There's no doubt it's a job, but sometimes it's turning into a business. So it, you don't have that time, and people are telling you how much time, but you have to. I mean, I don't think I'd ever get myself into a position where I couldn't take an extra 10 minutes or an extra 20 minutes. or you end up calling them at night where it takes away from your personal time. But that's what your family will admire in you, I think, that you do things like that. I think you're right, 100% time is of the essence, and you don't have that time. They're saying one person every 15 minutes. You can't get everything in 15 minutes, so you don't type the note in while you're in the room with them. You type the note in later that night if you can remember. But, I mean, you have to sort of because well, for me, the compassion makes a huge difference in how you care for somebody. Then you don't need a physician. You could use the nurse practitioner, physician assistant. You don't need me. But for me, understanding beyond what their disease is makes a huge difference. So that is time, and that is a problem. I agree that the way medicine is going, businesses don't want us to spend time, but you have to make it, I think, or
So
find it.
so interestingly, I think to that point, the things that as I was have been looking into the evidence of compassion, I'm seeing that there is a lot of practicing compassionate care, or like looking into the compassionate care and taking those initiatives. Um, the all many of the metrics actually go up. That's what I'm seeing on evidence, right? I mean, there is evidence out there that like the patient experiences go up, the physician burnout. I mean, which we are seeing a lot these days.
Yeah.
We see a lot of physician burnout. They don't feel fulfilled, and we're not enjoying a job. So all these are getting better with practicing compassionate care. But again, we also see that demands from not everybody, but some of the leaders in general in the hospital system. Right. So, what would you suggest for the leaders in terms of navigating through this world of
Yeah,
business?
well, no, I mean, I tell people to when you're looking like students and fellows, when you're looking for a job, that you have to find what makes you fulfilled, and sometimes you're stuck if you have to be in a certain location, whatever. But to me, jobs that are business managed as opposed to physician type managed, I mean, there is more money involved if you see someone every 15 minutes as opposed to every 20 to 30 minutes, so you will make less money. But finding a job that allows you to practice medicine in a way that is compassionate, that you have that ability to have that time to do that without someone putting your head in a vice and saying you have to have this done by a certain amount of time and you have to see 15 people in so many periods of time. So I think it's finding the job where it allows you to do that because I think part of medicine is now too mechanized and not allowing for this compassion. There are, the palliative care team, so you can call them in and they can do the compassion. But as a physician, that person is still your patient, so you should be part of that compassion, not calling in somebody. It's one thing to call in a radiation oncologist to give a radiation therapy. It's something you cannot do, but the
Yes.
physical compassion to someone, you can do that. And
Mhm,
sort of farming that out to another physician sort of defeats the purpose. So I tell people when you're looking for a job, make sure you have that, what now I can call a luxury, to sort of communicate with your patients, that it's not so much a business of one person every 15 minutes, or you have to do this and you don't have the time to run over or stay late because the office is going to close at 5 o'clock.
mhm.
So I think that's a hard thing to do, or hard to find a job in medicine these days like that, or to be able to practice like that.
Would you think that should be? I mean, how can we bring that back to the business, the world of business? Because I think I mean, they're heart centered leaders, and I was just talking to somebody else who, I mean, the top-notch healthcare organizations, and they were looking at these top-notch healthcare organization, and what they found is basically that internal alignment and the love and the care that they were giving out, right, out the spreading. So, but still, there are models like that, more heart-centered leaders and compassionate leadership is out there. But I don't not sure if it's very prevalent. I don't know. I mean, do you have any ideas or suggestions
Well,
to
I don't
bring
think
that
so.
to?
Like people like the venture capital taking over practices and managing them, I think that takes away from it. And I think I'm not sure how physicians lost control of their practice or of their business in a way. I mean, I have to say that I don't understand business, so I would not be very good at managing the finances of all that. So you have to find a business person who understands where you want to be and help you do that. But I think of these big companies that now run medical practices and they're buying them all up, and that is so becomes so impersonal. And I don't know how to get out of that. Although a lot of people leave it or don't let them, go to a different practice. And maybe it's not so much in a more rural America as opposed to more industrial, East Coast or big city, I should say. But I don't know. I mean, I don't know if you have any ideas how to get around the fact that medicine has become somewhat business, and I don't know how to get rid of those people.
I don't know. I think one of the things that we would want to do through what we are doing at this moment is like bring out those special organizations who are actually doing well in the organizations itself, and that there are leaders and organizations like that who are doing well despite not focusing on the numbers and the business aspects of it. And hopefully, we can shine more light on such systems
No,
and
I mean, I would love to figure out how to change, but I mean, it becomes enticing. They say, we'll give you each $1 million if you sell to our practice. Well, that sounds great. You have two kids in college and $1 million, it can go a long way. And so I think that sort of change, and then we run everything for you. You don't have to do anything. So that becomes enticing. But then a lot of people I've spoken with who are in that position, they're not so happy anymore because they have lost control. And now they're just like any other person working in a sort of job, a 9 to 5 job. It's not your job and it's not your practice. It's not your heart and soul anymore. You've like
that's
sold to the devil.
that's so unfortunate, right?
Yeah.
And
No, it's like you sold your soul to the devil in a way. It was
that's
okay if you're towards the end of your career, yeah, you got your $1 million, you're gonna leave in 3 years and you can sort of fudge your way through. But if you're at the beginning of your career, I've talked to several, people who are finishing residencies, finishing, and I really tell them you have to find a place that's not gonna sell to venture capital if you can get away with it, because I think that takes that impersonal, compassionate role of a physician and doesn't include that in what they think is productive or financially beneficial.
yep. Yeah, that's hard. Righto. So I think I would like to talk a little bit about. I mean, you said your physician is sorry, your daughter is a physician.
Yes.
Uh, and so I know you spend very long hours in the hospital. I'm not sure if that's how you were all along. I mean,
Yes, that was
always in the
me. That was
hospital.
me. Yeah.
So I just wanted to understand, growing up, how did I mean, did you have time for your children and how did they feel? And if that's okay.
Yeah, no, I mean, I think it was hard. I remember, like I had a woman who took care of her and picked her up at school. I'll never forget when she was like I don't have the play dates, mom, because you're not in line to talk to at the pickup line to make me a play date. And I said, oh my God, so do I have to change that? And you sort of try and integrate things, like you're not the class mom, but Mary's mother's the class mom and she's always there and you're not there. But, you spend the time and then at night and you're there. You know, and I moved my job from farther away from home to closer to home so that I could do that. So I was in a more academic position before, and I shouldn't say I gave that up, but I did give that up because I would have liked to have done at that job more, but I couldn't. If you want to have a kid, you have to sort of weigh that. I hate to say this, but I don't think men have as much concern for that as the mother does. But that's just between you and me. So I think that's a problem. But so it was hard, I think, for my daughter at first to deal with that. But I think now she was sort of proud of the fact that her mother wasn't an at-home mom and that, I didn't just, after I dropped her off at school and made a play date for 4 o'clock, that between 9 and 4, I did nothing. I mean, she didn't starve. She had food. It may not have been gourmet, but she ate well. And, the laundry was always done. And I think she sort of, as she matured, she realized that there's something more to life. And maybe that's why she went into it. But to have something that gives you fulfillment. And she said, how could you be fulfilled, I don't know, playing bridge or mahjong every day? Was it just sort of, so I think kids sort of sense the fact that you feel, as long as you feel good about your job, that they feel good about it too, and that they're proud of you.
Yeah, I think that's exactly you already, I think, answered my next point. Like, generally, yeah, growing up, probably they have all those, but once they grow up and they come to that level of professional or in general being a mom themselves, then they would recognize all the beautiful things that were done despite having the challenges of job and being a physician, right? I think they recognize that very quickly. And
And I think at least, I think most kids will hopefully recognize that it wasn't, that they made something of themselves, and that and as a result, your kids make some and do something good for the world or for your community.
Uh, so I just have a few more questions quickly, right?
You got all the time you need.
All right. So when I say compassion, what's the one word that comes to you?
I guess caring, love, something like, I mean, empathy,
And if I say healing, what comes to you?
healing. I think, well, I say you'll be encompassing the care and continuing it. It doesn't stop just because you fix the problem. You need to continue to care, so that helps them continue to heal. So I think long-term caring, I guess. I'm not sure. I never really thought about that.
Yeah. And how about if we say, I mean, are there any books or anything specific that you remember and picked up through this your journey of oncology and in general that made a huge difference?
I'm not so sure I ever read a book that made me feel more compassion. I think it was the feedback that I got from my patients that made me continue to want to not do to perform that way or to act that way or to treat patients that way. That when you get positive feedback, you want to keep going with it. So I think it was the fact that I gave my compassion and they felt it and made me feel good too. I mean, not just them, that wanted me to continue doing that. I can make them feel better. And I felt really good about that, that patients liked me, or they cared about me too. They would ask me about how my family was. And I think that that was something that was good. That's a way you want to be, that the patients care about you too, to some degree.
So apart from the caring about you and your family, what are the other ways that they've expressed the feedback when they felt it, when you pet?
Well, I discussed it with their family members. If you hear them talking in the waiting area, that they sort of appreciated you. I think, they would donate to an organization in your honor, saying that this was a good thing for better or for worse. So I guess, I don't know, I guess that's part of it.
Got it. So if we want to, again, I think probably if we wanted to give some practical tips for somebody who's starting fresh, practically that we can do on a daily basis and start. If we can, you suggest three things that somebody could actually start doing it early on in their
Well,
career.
when you do your H&P, get the family history and sort of understand what's behind them in terms of the family history. And sort of ask the patient, what do they expect from me or from the physician? Yes, they want to get better. Is there anything else they have any expectations from me? Am I there for them? Can I help them on a social level, financially? So sort of understand that some people don't have everything. So make sure that they understand that you can help them or you can get them to a source that will help them do that. I guess, and let them know that give them, I mean, I used to give out my cell phone, but to let them know that you're there, that, it's not just the 15 or 20 minutes that I've got assigned to you in my office, but we have an hour relationship that goes on for forever, so that you're always there for them.
So to wrap up as three things like get the family history
Well, their
and
personal history, I should say, just that goes along everything, what they do, let's just sort of understand them as a person before they got their illness. Who were they? What were they now that they got hit with an illness that may totally change their lives, and probably will, whether they get cured of it, but it's still a scar that they will have or a piece of them that will always be there. So I think to understand who they were before they started the journey with you as a physician.
would you think we will be able to look at oncological patients? Probably it's a different set of population. And I think generally people feel that it's easier to be compassionate to them compared to the other set of population, non-oncological conditions and all those things. I still feel it's the same thing, like there is a disease and a condition and scarring, right? It's
Oh,
still the
100%. I mean, you could have bad heart. I mean, you can't if you can't fix that, it's the same thing as a cancer. It is. It's just that the word cancer has so much more deep-seated connotations.
yeah, it does. It does. You also said that after your retirement recently, you started working at a clinic and more for the uninsured. I mean, is that in an oncological position or non-oncological position?
Well, it's mostly hematologic because You can't give out oncology care there because the cost is high at these free clinics, so we don't do that, but so we do the initial evaluation, and then if you need to, you can get them to someone else. If it's a hematologic problem, then hopefully you can sort of somewhat manage an iron deficiency, you can work up, a bleeding disorder, so it's not as intense as the oncology, but you still need some compassion because these people have nothing to begin with, some of them.
So, coming to last few questions, fulfillment, right? Or how do you feel one can feel fulfilled in their life?
You have to like what you do as a living, whether it's medicine or whatever else you do, that you are making a difference, whether how small it may be, whether you give them a hamburger that they'd like tasted good or you cleaned a room in a hotel, that you've done your best, no matter whatever level it is that you've done your best.
Do you think we all should have a purpose in our life and that makes a difference to our own quality of life?
I do. I think you have to have I mean, for me, you have to have something to me, it was that when I retired, I had to have something to get up and go for, that it wasn't just getting up, "Okay, I'll read a book today or I'll do a puzzle or something." So I think it's good to have a purpose or a reason to live, a reason to get up and do something, no matter how old you are, as long as you can physically proceed.
And overall, I mean, is there anything that you would like to share with us that we haven't
You've been
discussed?
very thorough, but no, I mean, as a physician, as you probably why you asked me to discuss this with you is that you have to care about your patients. For me, that is most important, and if my physician doesn't seem to care about me, then I'm moving on to another physician. But I think caring about the patient is a huge part of them getting better and you helping them improve or maintain. The compassion and love is there.
Got it. Thank you again. Thank
All
you.
right, well, say hi to everybody at Bryn Mawr for me.